Guys, this is Dr. T and welcome to Clinical Medicine with Dr. T. So guys, so we're gonna be doing an overview of anesthesia. So we're gonna be doing an overview. I love overviews because they help us to sort of like be able to put things into perspective, to know what belongs where, even if you don't have the full understanding of anything, but we at least know how to put things together. Like for instance, it doesn't make sense to know bupivacaine in and out, the dosages, side effects, and all that, if you don't know when you're gonna use it and what kind of anesthetic technique you're gonna have to use bupivacaine and that kind of a thing. Another thing, as you guys, I'm sure by now you know that I'm not a very big fan of definitions, because I mean we always forget definitions. So the way I like to think about anesthesia is, we want to do an invasive procedure that is uncomfortable, that is painful on a patient, but we don't want this patient to feel pain. That's when anesthesia comes in. We want to do an invasive procedure, which is most of the times it's surgical. Most of the times it's surgical. It can be non-surgical. Like for instance, when I say non-surgical, when you are doing manipulation of a fracture, that's not surgical. It's non-surgical, but it's still painful. So most of the times it's a procedure that you want to do on a patient, and you know as a doctor that it's a painful procedure. So what you want to do this procedure, but you don't want the patient to feel pain. I'm sure guys you can pick up the tiredness in my voice. I'm very tired. I'm just coming from work now, but I feel I need to do these videos, so please bear with me. So you are a doctor, you want to do a procedure on a patient. You are a doctor, you want to do a procedure on a patient, and this procedure is painful. You know it's painful, but you still want to do the procedure. So what do? You bring anesthesia in. So you want to continue and do the procedure, but you don't want the patient to feel pain. So anesthesia is all about taking away the pain. It's all about taking away the pain. Like I'm saying, it's not a test. This is not a textbook definition. At this point, we don't really care about textbook definitions, but we want to understand what we're talking about. So you want to do a procedure. Most of the time, it's a surgical procedure, but not all of them are always surgical. But it's a painful procedure. It's a procedure that has got a very high potential to cause pain at the patient. So you want to do that procedure, but the patient must not feel pain. That's what anesthesia is about. Now, what are the types of anesthesia? There is general anesthesia. There is general anesthesia. Let me try and use the right one. We have general anesthesia. We have regional anesthesia. We have combination of these. Combined, general, regional. Right? We've got general anesthesia, we've got regional anesthesia, and we've got combined general, regional anesthesia, or combination of general and regional anesthesia. Right? And then we have we've got procedural sedation. Procedural sedation. Procedural sedation was also called conscious sedation. Conscious sedation. Conscious sedation. Guys, I'm tired. And out of all these types, okay, let me not lie. I almost said that out of all these types, this is the one that I've done the most. It's not, I'll tell you. There's I'm gonna put local here, guys, ne? I'm gonna put local there. And then when I say local, local can be topical, right? Like your spray, your lidocaine spray, and like your Elnac cream. So those are topical. Under local, you can also have infiltration. Guys, there are things that I'm gonna say here that are gonna help you to understand anesthesia. Not necessarily that they are in the book, but they will help you to understand. For me, I find it difficult. Maybe someone else can come in and explain it to me or differ with me, but I find it difficult to put local anesthesia under regional. I find it difficult because when you talk about, as we're going to do the definitions now, just to, not the definitions per se, but just to explain what we are really talking about. Okay, let's start with general anesthesia. General anesthesia. There's another type of anesthesia that I'm forgetting. I will tell you now. I hope I'll remember to put it, but they call it the MEC. The MEC. It's something anesthesia care. I'm forgetting the M. I'm forgetting the M. And it sounds like a recent thing though that they've just come up with. Any case, we're saying the types of anesthesia: it's general, it's regional, combined general, regional, procedural sedation, and then we've got local. And when you talk about local, we are specifically talking about things like topical and infiltration, and the MEC. It's not local though; it's on its own there. So now let's move on to general. General anesthesia is where there is loss of consciousness. Let me put it this way. There's that triad that they talk about. So the components of general anesthesia, every whatever technique that you administer or you employ on a patient should be able to give you analgesia. That's what you want to take away the pain. So we've got analgesia, so it gives you analgesia. These are the components of a general anesthesia. There's analgesia, there's hypnosis, or loss of or unconsciousness. Unconsciousness. And then there's amnesia. These are the components of a general anesthesia. You don't find amnesia in any of those. You don't find loss of consciousness in any of those. These patients are all of them, they are fully awake. All of these patients, they are fully awake. You know, the nice thing about these guys is that the way I've put this is that maybe you're asking yourself, where is spinal anesthesia? Where is epidural? So now you'll understand where spinal anesthesia fits. You'll understand where epidural fits after we are done with this overview. I love overviews, guys. I love overviews because when you have an overview, even if you are in theater or wherever and they are talking, people are talking, you will know exactly what they are talking about. If they are talking about spinal, you will know exactly where to put your spinal. You will know exactly where to, whatever information that they give you, you will be able to put it somewhere here. Okay, so we say anesthesia, general anesthesia has got this components. This is what makes general anesthesia difficult, because you have to have these components in all your patients. You must make sure that you take care of all of these components. Now, so we said that anesthesia is about taking away the pain from a patient as you are doing whatever procedure that you're doing. As long as it's a painful procedure, it doesn't have to be surgical, as long as it's a painful procedure. And then you must make them unconscious in general anesthesia, or you must hypnotize them. And you must make sure that they don't remember the procedure, which is amnesia. So what makes general anesthesia difficult or complex is that you have got to give drugs that will take away the pain. You must give drugs that will give them amnesia. Because they are unconscious, it means the airway is compromised there. So which means you must manage the airway. And airway management alone can be a nightmare. Especially for us who are junior doctors, can be a nightmare. Airway management. It's a big topic on its own. Just because they are unconscious, you can't give them all the drugs that you have to give them and not take care of the airway, because you know by virtue of them being unconscious, you need to protect their airway. Now, there are other things that people are bringing in, that in general anesthesia there's an element of muscle relaxation as well. But the traditional triad of general anesthesia is these three things. You see? So, let's talk about amnesia. So, when they were still developing this concept of general anesthesia, those heroes of ours, those old clinicians and scientists, they did discover that when you do a GA, as much as you can take away the pain from the patient by the drugs that you give, there are patients that because they are aware of the procedure, they sort of like see everything. You need to make them to be unconscious so that they don't see anything. And also there are patients that can still remember the traumatic surgical procedure. I mean, there is no person who can be operated on their bowel, they see everything, and then that that sin does not come back to haunt them later on in life. I mean, I think very few patients or very few people will not have problems. I mean, some people, they get disturbed from just seeing blood. Just seeing blood, they collapse. Just seeing blood, they get some psychiatric symptoms. So there are some. So they discovered that there are patients who come later with some sort of some symptoms, psychiatric symptoms like intrusive thoughts, and they get those dreams, the nightmare, all those things, just because of the procedure. So they decided, okay, we should just knock these people out so that they don't, we should give them drugs so that they don't remember the surgical. So obviously the procedure is traumatic to them. And also, I mean, trying to manipulate it. I mean, some people, even a broken bone, seeing their bone popping out of their skin can be very traumatic for them, and all of that and all of that. So that's where the amnesia comes from. That let's try and make them not to remember. Because I mean, these people would come back with psychiatric symptoms later, a couple of months or even a couple of years after the procedure, they would come back. And then they thought, no, let's just give drugs for amnesia as well. So that's the general anesthesia. So what makes general anesthesia different, like I said, is that there is loss of consciousness. And because of that, airway has got to be managed. And this on its own is complex. And then drugs that give them amnesia and analgesia, all those things must be given. So because it's even worse if you use muscle relaxants, you need to give drugs that will reverse the effect. Those drugs are not without problems as well. Even the drugs that you give to relax the muscles, they are not without problems as well. So as much as you are concerned about this, you need to manage the drugs that you're going to be giving, because there are so many drugs that are involved here. Let me just put it this way. With general anesthesia, there are 3 phases or stages. I don't know what you want to call them. There are 3 phases. The first one is the induction phase. Is induction. The second is maintenance. Then the third one is emergence, meaning waking up the patient. Waking up the patient. So you've got induction, you have maintenance, you've got emergence. There are drugs that you give for induction. Those drugs are not without issues. There are drugs that you give for maintenance. Those drugs are not without issues. There are drugs that you give for emergence. Those drugs are not without issues. So there are so many drugs that you give on top of everything else, preparing the patient, all those things. And also, there is an issue of comorbidities. I mean, a patient who's got so many comorbidities is more difficult to give a J than a patient who does not have any comorbidity. And also, the other things as well. Are they pregnant? Are they not pregnant? And all. So, general anesthesia become complex because of things like that. But we are going to talk about GA and do this, talk about induction, maintenance, emergence, all those things. This is just an overview. Let's talk about regional anesthesia. Oh, so regional anesthesia is also called neuraxial anesthesia. It's also called neuroaxial anesthesia. Under regional anesthesia, we've got spinal anesthesia. We have epidural. We have a combination of, so it's combined spinal epidural anesthesia. Right? So I'm saying under regional, we have, it's also called neuroaxial anesthesia. Under that, we've got spinal, we've got epidural, we've got combined spinal epidural anesthesia. The other one that we have under here is your peripheral nerve blocks. Peripheral nerve blocks, I mean, any group of nerves can be targeted there. You can do a lower limb, the entire lower limb. You can do the entire upper limb. You can do a foot. You can do you can do the neck, you can do the trunk, and etc. Even the scalp and things like that. So we are gonna talk about spinal anesthesia. It's very important to talk about it, go in detail, talk about what it is, and the indications, contraindications, the complications, how to manage the complications, things like that. Maybe we'll talk a bit about epidural and stuff like that.